Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
But what about the side effects? So you would think, well, if this is good at boosting the body's immune response against melanoma, what would happen if you accidentally boost the immune system too much? And that's the problem with the side effects that can sometimes happen, in that any organ in the body can get inflamed with side effects. And this is a cartoon I put together for a medical journal a few years ago, showing all the different organs in the body that can get inflamed. And you may think about the suffix itis, I-T-I-S, that means inflammation. And if you have any organ and then you add the suffix itis after that organ, that just means that organ is inflamed. So pancreatitis, for example, is inflammation of the pancreas. Colitis is inflammation of the colon. Pneumonitis, pneumonia, or pneumo is lung, and pneumonitis means inflammation of the lung. Any organ in the body can get inflamed from these treatments. And it's important to tell your doctor, if you're receiving immune therapy, that as you're turning on the activity of these T cells, you want to make sure that you don't turn it on too much. So tell your doctor if they're doing too much with the immune therapy, because it might be necessary to give temporary immune suppression to lower the immune response down a little bit if it gets too activated. Some of the side effects can be well treated with topical treatments. And this is an example of a patient that had dermatitis, or inflammation of the skin, dermatitis. This is a rash that a patient I took care of had, and we had to give cream to make the rash abate. And this often can be treated with just topical hydrocortisone cream. This is a picture of a patient that had diarrhea and colitis. This is a colonoscopy evaluation on the right, and what it might look like if you look on the inside of the colon in someone who has an inflamed colon that's caused diarrhea. And you can see there's a lot of edema and yellow mucus here. And so this often needs to be treated with steroids or other drugs to reduce diarrhea. And we're trying to understand why some people have side effects and other people don't. It's a really interesting question. In the case of colitis, we've found that certain types of bacteria are actually associated with a protective presence for bacteria. So I don't want you to worry about all these weird names at the bottom and all these fancy graphs and things, but I think that PTC means progressed to colitis, and CF means colitis free. And these blue dots here and red dots indicate that patients that did not have colitis from a certain type of immune therapy had a higher abundance of a certain type of bacteria called Bacteroidetes. And so a lot of trials now are trying to test whether you can manipulate the bacteria in the gut to have a reduced risk of colitis. And if you get colitis, maybe there are certain ways that we can manipulate the bacteria there to help make the colitis go away. This is still an area of research, but one that's very interesting and a good example of ways that we're trying to figure out how we can mitigate side effects and improve side effects in patients that have different kinds of symptoms from excess immune stimulation.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly and Exelixis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.